Thank you so much for having us, and thank you for everyone who has joined us today. My name is Samantha Sathry. I am the program manager for the Alzheimer's Association Greater East Ohio Area Chapter. We serve 17 counties in Greater East Ohio and have the privilege of offering free support services to people living with Alzheimer's and dementia and to their caregivers. So we just wanted to say thank you so much for joining us, and we hope you find this presentation very informative. Thank you.
All right, well, thank you very much, Julie and Sam. As Julie said, my name is Melissa Chambers, and I will be presenting on behalf of the Alzheimer's Association today. We'll be talking about knowing the 10 signs, and early detection really is so important. And so, as Julie said, there was a question that came in already, and I do believe that it's sort of a two or three part question. I believe that all of that is going to be answered during the presentation. However, if it's not being answered, please feel free to type it in the chat below, which you can find at the bottom of your screen, kind of in the middle, or feel free at the end when we unmute people that to ask at the end. All right, so the first thing we're going to talk about before we can get to the 10 signs is talking about what dementia is in the first place and understanding it. So that way everyone is sort of on the same level when we're having this talk. So one of the very important things to realize and that a lot of people don't know is that dementia is not a specific disease. It is just a general term. It is a decline in your mental ability that's severe enough to interfere with your daily life, your activities of daily living. It's just an overall term that describes symptoms. So if we think of it sort of as an umbrella term, then all the different actual diagnosis and all the different kinds and types of dementias are underneath. Alzheimer's disease being one of the diagnosis and the most commonly typed diagnosis of dementia. Vascular dementia is another one that is fairly common, and this is what happens or what can happen after a major stroke or several minor strokes. Frontotemporal lobe dementia, dementia with Lewy bodies, etc. There are, I believe the count is up to over about 120 different types of dementias. So Alzheimer's disease, as I said, is one of the types of dementia. It is the most common form of dementia. It is a progressive disease of the brain. It destroys brain cells, causes problems with memory, thinking, and behavior. And although some treatments are available to help with symptoms, it is a disease that is eventually fatal. At this time, we do not have a cure for it. So we're going to cover some myths here first. The first myth is having a little touch of dementia is a typical part of aging. We used to hear the term senile a lot, and it used to be the belief that as we aged and as we got older, we were all going to be senile. Some people would say we were crazy, oh, you just reached this certain age and, this is just what happens. And we know that that is not true now. So as we age, many of our physical capabilities, including memory, start to diminish. But having a harder time remembering some things is very different from having a form of dementia, such as Alzheimer's. So on your screen, you're going to see a picture of a brain, a piece of a brain. On the left side of the slide is what a healthy brain should look like. And when I say healthy brain, I mean a brain that does not have Alzheimer's disease. On the right side is a brain that has severe Alzheimer's disease. And so I think that this picture, or when we look at any pictures of brains comparing the two, is very, very important and very significant. And it's impactful for us to see this, because if you'll notice, if we're saying the brain on the left side is what it's supposed to look like, we see a lot of changes on the right side. It is much smaller. There are spaces that are almost completely missing altogether. The normal brain weighs about 3 pounds. And a brain with severe Alzheimer's disease is about 1 pound. So that is pretty significant. And so again, because we can't see the brain, we can't see these changes happening. And sometimes it makes it harder for us to understand what's going on and why things are happening. Another myth, if Alzheimer's disease runs in your family, and I believe this is going to sort of answer part of that one question, genetic testing will tell you whether you will get Alzheimer's disease too. And in reality, having a parent or sibling with Alzheimer's disease, it does increase your risk, but genetics is not the only factor. So to talk about genetics a little bit, there is a gene that is linked to a greater risk of late onset Alzheimer's disease. It is the type of dementia that's most common and associated with older age. It's a good idea to discuss these benefits and risks of getting tested. However, it is important to note that if you do get tested and you do have this gene, it is not 100% for sure written in stone that you will get Alzheimer's disease. You will get the diagnosis. It's not 100%. It increases your chances, but it's not 100% that you will get the disease. So age, when we talk about risk factors, age is the greatest risk factor. The incidence is higher in women, and family history can, again, also increase your risk. There is a body and brain connection. So if we think about it, you know, everything is connected. Our vascular system, our brain, our heart, all of these things, the blood vessels, everything is connected. So brain health comes from a healthy body and an active social life. Risk for Alzheimer's disease or vascular dementia is increased when we have heart problems, damaged heart or blood vessel. Diabetes in midlife can also increase our chances. And there is a very strong link between serious head injury and a risk for developing dementia. So there are several things here that can put us at risk. Okay, we're going to move on to the 10 warning signs now. And the Alzheimer's Association developed this list of 10 signs just to kind of help us understand the difference between normal aging and then some possible signs of dementia. The list is only intended, I just kind of want to make a note here that the list is only intended to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. It is very important to understand, though, that this list is not meant to diagnose you or your loved ones. If you have some of these things on the list that we're going to talk about, that does not mean that you have Alzheimer's disease or that your loved one has Alzheimer's disease. This is just simply, these are examples of the most common changes that people experience. Okay, so we're going to go ahead and review these. The first, memory changes that disrupt daily life. And I guess really quick before I start about this, I just want to make a note. When we talk about typical age-related change, you know, there are some physical things that are age-related, such as when we look in the mirror, we might see extra wrinkles where we didn't see them before, or our hair might start turning gray and it wasn't before. And those are physical age-related changes. And then we can also have age-related changes with our brain. And so when we talk about normal, just typical age-related changes, that's what we're talking about. Okay. So the first warning sign, memory changes that disrupt daily life. These could be things such as forgetting something that we recently learned. If a person is just asking the same information over and over, if we have to rely on memory aids or family members to help us remember things that we used to do alone. Okay, so those could be a sign. A typical age-related change would be possibly sometimes forgetting information that we knew, but then remembering it later. Okay, all right, the second one, challenges in planning or solving problems. Problems developing when we're trying to follow a plan, when we're trying to work with numbers, when we're trying to follow a familiar recipe, we just kind of can't keep track. Trouble with our bills, challenges concentrating, that can be a big one, and taking much longer than before to do common tasks. I'm going to throw in a quick story here. I once had a family that I was helping. It was 3 daughters. They were moving their mom into the building that I was working at the time. She had Alzheimer's disease, and they were trying to take care of her at home, and they would take different shifts and sleep there, and they were doing a very good job. They were great daughters, but they just couldn't do it anymore. So they decided to move her in with us. And the daughter had wrote me a check for the first, invoice for the first month. And she said that her mom had a certain amount of money in her checking account, and then the rest of her money she had to get from an IRA account or something like that. And it was going to be a little more difficult to get. So she wanted to just pay me everything that her mom had in her checking account. So she would be paid a couple months ahead of time, but so that she would have time to get that other money. So she writes me this check for $13,000. And a couple days later, my corporate office called me and said, this check bounced. The check bounced. And so I had to contact the daughter and tell her this. And I was shocked because she was very adamant about giving me this money. So she was devastated. She couldn't believe the check bounced. She was apologizing left and right. They're trying to figure out what's going on. Here, her mom wrote checks totaling $13,000 to the to a charity. The name is escaping me right off the top of my head, but it was to a charity. And they just kept taking all of this money from her. And she, instead of taking care of her bills, this is what she was doing. For some reason, her brain just got stuck on this particular charity, and that's what she was using. So, those are examples. A typical age-related change would be just making an occasional error with your bills or your household finances or something like that. We all make errors from time to time. Okay, the third warning sign would be difficulty completing familiar tasks. So these are tasks that you do daily. They're very familiar to you. Driving, maybe you're having trouble getting to one place that is familiar. Maybe you go to Giant Eagle all the time, or to a CVS or Walgreens, and that's just where you go. And then you try to get there and you're having trouble. Problems if you're still working, managing a budget, or that could be at home as well. Difficulty remembering rules of a favorite game. Let's say you have a card game that you play all the time, and then you try to play it and you can't, you're just not positive. So a typical age-related change would be occasionally needing help, maybe to use the remote, or if you're trying to learn new technology, or, help with the microwave or something like that. Okay, the fourth sign is confusion with time or place. We may have trouble understanding something if it's not happening right in the moment. These changes that we're going to talk about here can become more dramatic or profound in the mid to late stages of the disease. But things such as losing track of dates, seasons, time passing, forgetting where we are or how we got there, those can be signs. So what is a normal age-related change could be just getting confused about what day it is, or when did we schedule an appointment, and then we figure it out later. That can be a normal sign. Okay, the fifth sign is trouble understanding visual images and spatial relationships. So the diminishing ability to track our surroundings, difficulty reading, judging distance, problems determining color or contrast. Our peripheral vision can be affected, things like that. These things can be serious. They can impact driving, and that can be a whole other problem. Sometimes if it's us that we're concerned about, if it's yourself that you're concerned about, sometimes, we can't even think about not driving because that takes away our independence. If it's our loved one, the same thing. We don't want to be the person to take away their independence. But when we are having trouble, visual problems because of the disease, it can be detrimental. It can be fatal. We don't want to get in accidents. We don't want, anything to happen, of course. So this can really be a hard thing. It can also just navigating your environment, just anywhere where you're at, you could have trouble. So a typical normal age-related change would be like if you have cataracts and your vision was affected because of cataracts. Okay, the sixth sign, new problems with words in speaking or writing. So problems just following in a conversation, maybe stopping in the middle of the conversation. Maybe you just totally forget what you're talking about and you can't continue. Maybe repeating what was already said several times. Trouble with vocabulary. Maybe you just can't find the right word. Calling things the wrong name, you know, like instead of watch, we might say clock, you know, things like that. Just unable to find the word. So a normal age-related change would be maybe just occasionally having trouble finding the right word. Like, well, I just did that a little bit ago. I was trying to remember the name of the charity that my little lady gave her $13,000 to, and I still can't remember the name, but I will. So that is just normal, a normal age-related change. Okay, the seventh sign, misplacing things and losing the ability to retrace steps. So putting things in unusual places, maybe where they don't normally belong, where you've never put them before, really having trouble trying to retrace your steps to figure out where you were last and to try to help you find what you misplaced, and accusing others of stealing something can be another huge thing. This sign here often really concerns people, and it's not, to be clear, it's not just about losing your keys on occasion. Misplacing things from time to time and then retracing your steps to find them is a normal age-related change. But when you can't retrace your steps, that's when we're concerned, and it could be a sign. Decreased or poor judgment. So changes in decision-making and judgment, poor judgment with money, giving large amounts to telemarketers. There's the story I was telling you. Spending more impulsively, just buying things that, you know, maybe you never would do. Wearing clothing that's inappropriate to weather or season. So for instance, wearing a sweater in the summertime when it's 90 degrees, or walking outside when it's 20 degrees with a short sleeve shirt. Paying less attention to our hygiene and grooming can be poor judgment. This seems to be more common with individuals who live alone. A typical age-related change is when we're making a bad decision once in a while, like forgetting to get an oil change or something like that. That does not mean that, you know, we have dementia. Withdrawal from work or social events. And you know, it's funny, not funny, but, you know, during the time that we're in, you know, we don't have a lot of options about being social, and I swear, being in the house and, you know, for the past year, everything that's going on, I feel like it is making people feel more like they don't want to be social. They want to be social, but they don't really want to be social. I feel like it has made some people awkward. But withdrawal from work or social activities under normal circumstances. So maybe hobbies that, you know, you've always done, social activities, work projects, family gatherings. You know, maybe they were always on a golf league or a bocce league or bowling or, you know, any of those things, and now they just really don't want to do it. Losing track of a favorite sports team, maybe that you follow religiously all the time. Forgetting how to engage in your favorite hobby or your favorite thing to do, and just overall avoiding social situations. So these can be some signs. As we age, it is normal to feel uninterested sometimes with family or social engagements, but not all the time. We're talking about, you know, pretty much totally withdrawing. And the 10th and last sign is changes in mood and personality. So increasingly displaying signs of anxiety, agitation, confusion, fear, suspicion. Individuals living with dementia, they may get upset when they're out of their comfort zone or even at home. And so, you know, especially when we take them out of their comfort zone, you know, I've had families who, you know, maybe it's the dad that has Alzheimer's disease and the daughter says, you know, I bring him to my house to just get him out of his own house just for a change of scenery. He built my house and he comes here and doesn't know where he's at or what he's doing. And he gets really agitated and he gets a little anxious and he just says he wants to go home. And, you know, the daughter doesn't understand. Well, how could the dad not know his way around the house? He built the house. He's been there, you know, 20 times and he's getting anxious to go home. And so, and that's just a part of it. So a typical normal age-related change would be just to develop, you know, get really set in our ways, develop a very specific way of doing things and becoming upset or irritable when our routine is then disrupted or changed. Okay, so we covered the 10 warning signs. So now we're going to talk about getting diagnosed. And when we're talking about this, the earlier, the sooner, the better. Okay, we're going to again cover a few myths. So the myth is that there's no point in getting diagnosed because dementia is not curable or treatable. We know that. So it will just upset my family and myself. So why am I going to do that? Well, the reality is that early diagnosis is the only way to get early treatment. It makes sense, you know? So even though the treatment isn't a cure, it's still a treatment, it's still something. And so again, the sooner, the better. And plus for your, you know, especially for your family, you know, they would want to know what they're dealing with, what's going on, you know, what the diagnosis is, what the prognosis is, what everything along the way. They're going to want to learn about it so they can take care of the loved one. So that is very important to find out what's going on. The really super important thing is it might not be dementia or Alzheimer's at all. You know, so oftentimes there can be so many symptoms of dementia that's something else totally different. Some of these problems that we're having, they can be treated and reversed. It's not because it's not dementia. Some can be life-threatening, and so it can be very serious. And so it's very important not to ignore these signs or just assume that it's Alzheimer's. You know, when you go to the doctor to get the diagnosis, you know, they do blood work. I mean, it could be something like your thyroid or a vitamin deficiency, and all you need is some medicine and then you're going to be fine. It could be depression, could be very similar to dementia, and etc. There's a lot of things that can be similar. And so it's super important not to ignore that. So when we talk about medicine, I feel like this can be sometimes a hard conversation because, again, we know that that it's to treat the symptoms, and it's not to stop the progression. It's not a cure. It's not going to make our loved one better. It's just going to help some of the symptoms. So part one of the medications, cholinesterase inhibitors, they may temporarily improve or slow down the memory loss. Again, it cannot stop the progression. It's temporary. Other medications can help with mood and behavior changes. You know, when we talk about behavior changes, we're talking about anything that is not how our loved ones or ourselves normally act. So if we're a person that is on edge a lot normally and easily anger, and we're just mad at everything, or anxious, that might not be really a change in your behavior because maybe that's how you are. If you're someone that's super happy all the time and very optimistic, and all of a sudden you're very irritable, you're angry, you're agitated, you know, that would be a significant change. So some of those things, when we have behavior changes, we have medications that can help. And we always need to talk to the doctor about what treatment is best and what we can do. So the diagnostic steps. first we have to have the conversation, either talk ourselves into going to the doctor or have the conversation with our loved one to get them to go to the doctor. And, if it's you yourself that you're concerned about at some point in time, it's best to have a conversation with your family or friends or the people that's closest to you to help get them involved and maybe let them go to the doctor with you, because, two sets of ears are always better than one. And just to have that support. So once we go to the doctor will take a history, a medical history from the patient, a family history. They'll obviously do a physical exam. They will do some sort of a screening. One of the most popular tests that are done is a mental status exam, but they will do some sort of screening, which is like a questionnaire. They will also do a neurological exam, probably some brain scans, blood work, most likely. And so there's a whole full workup. And so it used to be, well, I think that I'm getting ahead of myself. I'll just go with the slides. Okay. So with an early diagnosis, you can have more time to consider what is the future going to look like and how do I plan for it? And I can't stress enough how important this is. So participating and arranging for your own care, participating in your care, caring for yourself as long as you can until you can't anymore or until you need help. And then what do you want things to look like? There's so many options. Do you want to be at home and have home care, and just have someone come in your home? Do you want to, I think one of the questions was, about assisted living and how do I know it's time to go to assisted living and when do I go to assisted living? So if you want assisted living to be part of your plan, it's good to plan ahead and let your family members or your friends or whoever is part of your support system know, I want to go to assisted living. It's okay. I don't want you to have to take care of me. I would like you to visit me and let the building take care of me. So assisted living could be part of it. Maybe you absolutely do not want to go to assisted living. And so you have to plan for that. And, finances are always a part of that. When dementia becomes part of someone's life, you can guarantee that expenses are going to raise because you just need things. You're going to need help, and, assisted living might come in the picture. And so when we're talking about assisted living, to answer the question specifically, no one can really tell you, okay, when this happens, or when you get to this point in the disease, it's time to go to assisted living. Nobody can really tell you that. It's really something that, the person and the family has to decide together. And if the person is unable to make a clear decision, then it has to be something that the family helps them decide and does what's best for them. Certain things make people realize that maybe they can't do this at home anymore, or maybe they just shouldn't stay at home anymore. And a lot of those things are behavior related. And again, I don't love using that word behaviors, but we're just talking about a change in the way that your loved one normally is. So for instance, we can talk about being angry, becoming agitated, perhaps combative. Sometimes we hear people hitting or kicking or pushing, and the spouse or whoever the caregiver is in the home, feels like their safety is a little bit at risk. Things like wandering, when our loved ones leave the house, they don't know where they're going. They don't have a specific destination they're going to. They're just wandering, and that can become very serious. So stressed out, just completely stressed, they become anxious. Sometimes those are reasons that people will think, okay, it's time to go to assisted living. When you or your loved one needs help with what we call activities of daily living, or ADLs, such as bathing, dressing, grooming. If the person living with dementia becomes incontinent, a lot of times, that's just too much for the caregiver. Too much, too often, they can't keep up. And so maybe sometimes that's part of the reason why. And so again, I could go on about that, but nobody can actually tell you, if this happens. Like I said, if A happens, then that means that you should go to assisted living, or if B happens, then you should do this. It's not black and white like that, but it is super important. Again, as we're looking for an early diagnosis so that we can plan, it's super important to think about living arrangements. And, some people don't mind thinking about assisted living, and other people are very, very much like, I don't want to go into a building, keep me at home, do whatever you have to. And so I guess I just want to say, when we're talking about the living arrangements, assisted living is not all that bad. And it can give you socialization where you may not have it at home. You may be living home alone, or you may be living with, one other person, or you may have caregivers from a home care agency coming in your home, but it's just one person with you. And we talked earlier about how important socialization is, and you get that in assisted living, and you also get the help that you need. So it's something to consider when you are planning for your future, and if you don't know a lot about it, maybe do some research or make some calls or ask your family to help you, because it is very important to know about that when you're trying to make plans. So we talked about finances. We know that it's a guarantee that your finance, that all of the expenses are going to go up when we have dementia in the mix. Legal matters. So again, I cannot stress how important it is to be prepared and to make these plans. When we talk about legal matters, I firmly recommend, and this is not necessarily the stance of the Alzheimer's Association, but I firmly recommend that you see an elder law attorney, because when we talk about legal matters, we have to have certain things in place that will just make everything more smooth. It will help us avoid things that don't need to happen, and it will enable us to plan and lay out what we want everything to look like, what we want to happen, and who do we want to speak for us if we can't speak for ourselves. And so when we talk about these legal matters, things like, if the disease would get to the point where you couldn't eat, are you going to want a feeding tube? If the disease would get to the point where you might need to be on a ventilator, do you want that? Do you want IVs? Do you not want IVs? Do you want CPR? Do you not want CPR? If you become to the point where you're incapacitated, who would be the best person to help you make these decisions? And are they going to follow along with your wishes? So thinking about all of these things beforehand are very, very, very important. And a lot of times we don't think about them until we have a loved one that is in a really bad place, and we now need to make a decision about this, and then we don't know what our loved one wants, and so when we are well planned ahead of time, our families don't necessarily then have to make these decisions for us in a crisis situation. Maybe they decide to give us a feeding tube, but maybe we never would have wanted a feeding tube, and they don't know that because we've never had these conversations. So again, I could go on about this, but just again, being prepared and planning for all of these things. And it's empowering to make these decisions because, at some point, when we have this diagnosis, we're not going to be able to make these decisions. We are not going to be in our right mind to make these decisions. And so it is very empowering to do this ahead of time so that you can make sure that you're participating in your own care. And then building the right care team and social network. So, a lot of times people will appoint maybe their oldest child as their power of attorney because they're their oldest child, and that's what you do. And maybe your oldest child is a person that is not really good with finances, and they wouldn't really want to take care of your finances for you when you couldn't do it because they're not really good at it. So maybe you have a child that you're appointing a power of attorney, but they don't really want to make these medical decisions for you because it's making them anxious, and it's just, they don't want to do that. And so again, when we are preparing for this, when we're talking about your power of attorney or the people that are going to be speaking for you when you can no longer speak for yourselves, then they have to know about it. We have to make sure that they want to be a part of this team, and again, have a network of friends and support. So when we talk about support, it is so important to know that you are not alone. There are resources everywhere, and the Alzheimer's Association is a tremendous tool to use. It's a tremendous resource. So I want to talk a little bit about the resources to you. First and foremost is the 24-hour a day, 7-day a week helpline. This is a place that you can call, again, 24 hours a day, 7 days a week, about anything that you're having trouble with. And they have very educated people answering those calls. And so again, that is so important, because it's so important to know, oh, I can just pick up the phone and call someone. I have help right at my fingertips. If it's 3 o'clock in the morning and I'm having an awful time and my loved one is up and I'm so tired and I don't know what to do, you can call the helpline. So it's very good to know about that. There is help managing your care, a support program to help. What does this look like, to educate you? There is free care and support for those living with Alzheimer's and for their caregivers. There's support groups. So all over the place, in all different counties, there's support groups that you can attend. Right now, the support groups are not in person. None of the programs are really in person. So just like this, we're doing it virtually. Everything is virtual right now. And at some point, hopefully things will open up to be in person again. But being online and being virtual is so much better than nothing. And so it's good to know that you can find support groups anywhere, and you can get on a support group. You can go to as many support groups as you want. You don't have to just pick one and go to that same one every week. But the support groups are invaluable. I have been a facilitator for support groups with the Alzheimer's Association for, I believe, about 12 years now. And I can't tell you how invaluable it really is. And, it's not because of the facilitator. It's not because necessarily, that I can educate you a little bit about why your loved one is doing what they're doing and what you can possibly do about it. It is more the camaraderie of knowing that there's another daughter that is going through the same thing with her mom that you are, or there's another husband that's going through the same thing with his wife, or maybe this wife has gone through the same thing with her husband, and that was last year, and now she's into another part of the disease, but she can tell you what she did. And you can try these different things, and really you don't understand it unless you actually come to it and try. And it is really a great resource to belong to a support group. You quickly get to know the people that are attending, and you quickly feel like a small family, I think. And again, it just helps so much to know that you're not alone during these times. Community education programs is exactly what we're doing right now. So we have a variety of community education programs, and the Alzheimer's Association does a great job. Samantha does a great job of letting people know when they're having them, where they're having them. Well, now it's all virtual. There are programs like Trial Match. There are online, if you go on the website for the Alzheimer's Association, the resources I feel like are almost unlimited. There are so many tools and resources, and if you click here, it brings you to here, and it's more resources. And so I do believe that the website is invaluable and has a ton of information. The Alzheimer's Association also has the Walk to End Alzheimer's all over the place. So right in our own hometowns. Last year it was virtual. This year we're trying to do it in person. The plan is in person unless that changes, but it's always good to get involved. Again, it's so helpful to be around people that are going through the same thing and to know that you can support this cause. The longest day, you can be a volunteer, you can advocate. And again, the 24/7 hotline, the helpline, and it's very important to know that that number is 800-272-3900. Again, 800-272-3900. So it's good to write that down, even though we will be sending out this information for you to get.